Welcome to Lecto. Today we are going to discuss forward grouping. Actually, if I want to determine the blood group of anyone, then I will do blood grouping, or you can say blood typing. Actually, we categorize the blood grouping into two: forward grouping and reverse grouping. In this lecture, we will discuss the forward grouping, and in this lecture, we will discuss in detail or the deepest concept of the forward grouping. In forward grouping, we take the RBCs or blood of the patient and take the antibodies or commercially prepared antibodies specifically. But in the reverse, we take the RBCs commercially prepared but take the antibodies of the patient. So, before we start the forward grouping, we first of all discuss the antigen that are present on the RBCs. So here you can see that this is the cell of the RBC. This is the RBC cell. And you see that here is the antigen which is called H antigen present on the RBC surface. So, in that situation, this antigen which is present on the RBC surface has ability to convert into the A antigen and the B antigen. So, when the N-acetyl galactosamine is attached to the H antigen, then it convert into the A antigen. So here you see that if the N-acetyl galactosamine is attached to the H antigen, then H antigen convert into the A antigen. So in that situation, you will see the A antigen formation. And when you will see that when the galactose attached to the H antigen, then it will convert into the B antigen. So here is a thing, and you have to remember. So in that situation, if I see that 60 H antigen present on this RBC, 60 H antigen present on this RBC, and if I say that H antigen convert into the A, what amount? So in that situation, you will see that I say that the 30 H antigen remains the same and only the 30 convert into the A antigen by the addition of the N-acetyl galactosamine. So here total H antigen 60, and in that situation half H antigen remain the same and half convert into the A antigen by the addition of the N-acetyl galactosamine. So this is the case 1. And on the other hand, you see that same the case. This is the actually the H antigen. In that situation, 30, you will see the 30 H antigen and 30 B antigen. So in that situation, total is 60. In that situation, 30 remain the H antigen, but 30 convert into the B antigen by the addition of the galactose. So this is the case 2. In some situation, you will see a single RBCs contain the both A and the B antigen. So in that situation, what will happen? Total amount of H antigen present on this RBC is 60. In that situation, you will see that the 20 convert into the A antigen, and you also see the 20 convert into the B antigen, and 20 remain the H antigen. 20 remain the H antigen. This is the case 3. So in that situation, this RBC has both H and A, H and B, H, A and B both. So on the basis of the antigens that are present on the RBCs, we declare it as A blood group, B blood group, AB blood group or O blood group. So in the case 1, I see only H antigen and there is no A and B antigen, then I declare it as O blood group. So in that situation, when there is only H antigen, I declare it as O blood group. So this is the O blood group when there is no A and B antigen. In case, here is the case when there is only A antigen present, on the basis of the A antigen I declare it A blood group. If there is a B, only B antigen present and H antigen also present, then I declare it B blood group. And when AB both antigen present on the RBCs, then I declare it AB blood group. AB blood group. So here are basically the 4 blood group: A, B, AB and O. So this is the basic concept. And in some situation, you will see the H antigen is not present on the RBCs. If there is no H antigen, then this RBC has no antigen, even the H antigen. So in that situation, it fall into the Bombay phenotype. What type? Bombay phenotype, which we will discuss later. So here is the basic concept. So here you see, if we talk about the A blood group, then here you see that what type of antigen present on A blood group? H antigen. So here is the case, H antigen. Second case is the A antigen. So these two antigens are present on the A blood group patient. Next, you will see that in the B blood group, you will see the presence of H antigen and also the presence of the B antigen present on the RBCs of the B blood group persons. In AB blood, we see the 3 antigen. Here is the H antigen and B antigen, and last is the B antigen, H, A and B. If both the H, A and B antigen present, then I declare it AB blood group. And last, when there is no antigen, only you will see the H antigen, then I declare it O blood group. You see that O blood group has lot of H antigen. But you will see A and B blood has small H antigen. But AB blood has smallest H antigen. So this is the case. You will see first highest H antigen present in O blood group, then A and B blood group, and last is the AB blood group having smallest number of the H antigen. So here are basically the different antigen. But if we talk about the RH antigen, so here you see that there are two situations. Here is the RH antigen. Here is the RH antigen can also be present on the RBCs. If the RH antigen present, then we declare it positive. If RH antigen is not present, then we declare it negative. Same is the case. You see, if present, then RH positive, otherwise RH negative. RH positive, if present, otherwise RH negative. So here are basically the different situation. So this is the basic concept. Next we move towards the AB, RH and H blood H antigen. So keep remember, you will see in the AB blood group, you will see the antigen will be opposite to the antibody. Antigen will be opposite to the antibody. Let's suppose if I say that A antigen is present, then the opposite will be the B antibody will be present. If I say that B antigen is present, then A antibody will be against to the B antigen. If I say both A and B antigen present, then I say no antibody is present. If I say that there is no antigen, I say that the A and B antibody is present, and this is the basic concept in the case of ABO. But in the RH and H, if I say that in that situation, in the RH system, antigen and antibody. So here is the case. If you see that RH antigen is present, then you will never see the any antibody against the RH. So this is the case. And if RH present, then we declare is RH positive. And if I say that if there is no RH, then I declare is RH negative. And in that situation, you also didn't see the any antibodies even. So in that situation, I think antibody should be present. But there is a case. If you see that here are basically the person having RH negative, you will see no any antigen present in this person. And if this person get the blood having RH positive, then what will happen? This person produce the lot of antibodies. What type of antibodies? RH antibody. So this is the case. Only the RH negative person produce the RH antibodies when he expose the blood having RH antigen. Otherwise, anti-RH antibodies will not naturally produce. They are actually naturally present against them, but they produce only when there is a stimulus enter to the body. So this is the case. And if I talk about the H, so keep remember, when the H antigen present, same is the case. When the H antigen present, then you will never see the H antibody. So when there is no H antigen, then you will see the H antibody. So this is the case. So this is the ABO antigen, this is the RH, and this is for the H antigen. Next, you will see the methods. For the forward grouping, you will see the two methods. One is tube method and second one is the slide methods. They are basically the same. In both the method, you will see the RBCs from the patient and you will see the antibody, or you can say antibody, that is commercial. They are commercially prepared and available in the different bottle. A antibody, you will see the blue color. B antibody, you will see the yellow color. And last is the D antibody, or you can say RH antibody, which is the white color. So next we will discuss the deep concept of the forward grouping. So here you see, we will discuss the case 1. Here are basically the two different person, and these two person come to the hospital, and they, or you can say lab, and they say that we want to know, or we want to know the blood group. So in that situation, normally if we don't know the blood group, then let's suppose for the sake of understanding, let's suppose this is the RBCs, and in that situation you will see the antigen A and antigen H. Same here, H antigen, and in that situation A antigen, and last is the RH antigen. So this is the case. If you see, this person has antigen A and H, this person has AH and another RH. And if you see that if there is A antigen, then the opposite will be the B antibody. So here is basically this one is the B antibodies. If you see the A antigen, the opposite will be the B antibodies. So the composition of both this person is here. This person having blood composition this one, this person having blood composition this one. Next, we want to test the blood group. Then what we will do? So first of all, we take the 3 tubes for the first person. Here is the first person and here is the second person. And for the second person, I also take the tube 3 tubes, or you can say slides. First of all, we add the, here you see, I add the A antibodies. A antibody. So this is the case 1. And in the second case, I add the B antibody. And last is I add the D antibody, or I can say RH antibody for the sake of understanding. So this is the 3 case. And we take the 2 drops of the antibody in this case and in the for this second person. First for the first person, for the second person. And as we know that the RBCs will enter in that situation. If you see that the RBCs enter in that situation. So this is the case. And if you see that this A antigen will react with the A antibodies. This is the same. As we have discussed that in normal opposite, if there is A antigen, then opposite will be the B antibodies. But in that situation, if the A antigen and A antibodies combine, then it will cause agglutination. If the same, keep remember, if the same antigen and antibody come together, then you see the agglutination. Otherwise, you will never see the any agglutination. So same here, that here is the A antibody, and as you know that this RBCs has A antigen and they fit, and it has another antigen and which is called the H. So same here, if the A antigen and A antibody combine, and in that situation you will see the agglutination. This is the case 1. Next, if you see that this RBC is present in this one, and you will see that this RBC has A antigen and H antigen. So this is the case. And in that situation, you see that this B antibody cannot fit with the A antigen. This is the normal case, as the case which is present in this person, in the body of this person. So this is the case, B antibody cannot react with the A antigen. So this is the case, you will see agglutination in the first one, and you will never see the any agglutination in that case. And in the last, you will see that this RBCs has A antigen and H antigen. So you people tell me, there is any agglutination? No, because D antibodies cannot react with the A antigen. And in that situation, you will never see the any agglutination. So what blood group will be the of the person 1? So in that situation, you will see the agglutination in first case, in which you add the A antibody. So I say that this person has blood group A, and you will see that there is no agglutination in the last D antibodies or RH antibodies, then I declare it is negative. So this is the case. And keep remember that all antibodies, A antibodies, B antibodies and D antibodies are pentameric in form. Pentameric form antibodies can cause agglutination. And you also see that Rh antigen can also exist in IgG form, but can also be present in the IgM form. And if I see that I also add the A antibody, B and Rh, or you can say D antibodies. If you see, this is the red blood cell, and in that situation you will see the what type of antigen? A antigen. And you also see the two other antigen. First is the Rh, this is the Rh, and you also see this is the A antigen, and last is you also see the, here is the H antigen. So as we have discussed that A antigen can react with the A antibodies. So in this case you see the agglutination in the first case. Next you see that this is the RBCs, and in that situation you will see the H antigen, and you also see this is the A antigen, and last is the Rh antigen. Can A antigen react with the B antibodies? Not at all. As you can see that their shape cannot match. They are actually work like the enzyme and substrate. Proper enzyme can react with the proper substrate. Similarly, proper antigen can react with the proper antibodies. So you will never see the agglutination in the second case. And last is the very much important. And in that situation, here is the and in that situation this is the Rh antigen, and you also see that here is the A antigen, and here is the B antigen. So this point is very much important. Now Rh antigen is in front of the Rh antibody, or you can say D antibody. So in that situation you will see the agglutination. In that situation, you will also see the agglutination. So as we discussed that the Rh antigen, if you will see the Rh antigen is front of the Rh antibody, then you will see the agglutination. In all the three cases, you will see if the same antigen come across with the same antibodies, then you will see the agglutination. Otherwise you will never see the any agglutination. So same case Rh antigen is in front of the Rh antibody, then you will see the agglutination. So on the basis of the case 1, I declared, because in which you will see the at the A antibody. So I declare it A blood group, whether positive or negative. So if you see the agglutination in Rh antibodies, then I declare it positive. So these are basically the two cases, A negative and A positive. Next case is the, here are basically the two groups. Here are basically the two person 1 and person 2. So here you see that this person has RBCs, and RBCs having H antigen and another antigen which is the B antigen. Same here, the other person has B antigen and H antigen, and last is the Rh antigen. This is the extra one. And you will see that the B antigen, opposite to the B antigen, which antibody should be present? Keep remember, same antibody should not be present. So opposite to the B antigen will be the A antibodies. A antibodies present. Same B antigen, A antibodies. So these are basically the opposite, and they are normal. Blood composition of one, blood composition of the second person. Now same here, I add the A antibody in both one, B antibody in these tubes, and D antibodies, or you can say Rh antibody in these tubes. And what will happen? So here you see I add the blood group, or you can say blood in this tube, and as we know that these are the blood, the RBCs contains the H antigen and what antigen? You also see the B antigen. So can B antigen react with the A antibodies? No, they are opposite. They can exist, but move towards the next case. And here you also see the, this is the red blood cell, and in that situation you will see the first is the H H antigen, and you will also see here is the case. In that situation, you will see the B antigen. So, B antigen is opposite to the B antibodies. Then, same case, and in that situation, you will see the agglutination in that case. In that case, B antigen is opposite to the B antibodies. So, in this case, you will see the agglutination. And last case, you will see the here is the RBCs, and in that situation, you will see the B antibodies, you will see the B antigen, and here you also see the H antigen. Can be also in that situation there is no RH, so RH antibodies will not react with this case. So you will only see the agglutination in the tube 2. So I declare it with B blood group. So in the last case, you will never see, you didn't see the any agglutination. So on the basis of this, I declare it negative. So here is the case. Second one, when I add the blood in this tube, then what will happen? So here is the RBCs. Here is the RBCs, and you will see that here is the B antigen, and here is the H antigen, and here is the RH antigen. So this is the case. B antigen and A antibody opposite, they exist. Next, move towards A red blood cell, and in that case you will see the B antigen, H antigen, and you will also see the RH antigen. So in that situation, B antigen is just opposite to B antibodies. So you also see the agglutination in this tube. And last is case RBCs, and in that situation you will see here is the B antigen, and you also see here is the H antigen, and last is the you see the RH antigen. Now RH antigen is just opposite to the RH antibodies. So same case, so you will see the agglutination. So you see the agglutination in two, second and third. On the basis of second, we add the B antibodies, I declare it B, and last case I declare it positive, B positive. And move forward, then here are basically the two groups, two cases, and this is the person 1 and this is the person 2. And you see this person has RBCs, and what type of antigen present on the RBCs? A, okay, H, okay, and B, okay. Now can antibodies present in this blood group? No. You will see if A antibody is present, then A antibodies and A antigen, same case. If B antibodies, then B antigen is present, also same case. So in that situation you will never see any antibodies. So this is the case. Same here, you will see that the A antigen, same here, B antigen, and last is the AHB. And another antigen, let's suppose RH antigen also present in the second person. So you also see there is no antibodies present in that case. When I add blood in this tube, then what will happen? So here is the A antigen, okay, this is good. And you see the H antigen, okay, this is also good. And this is the case, this is the B antigen, this is the case. Now you see I add the, you see, keep remember, I add the A antibodies in this case, B antibodies in this case, and D, or you can say RH antibodies in this case. And you see now A antigen is just opposite to the A antibodies, then you will see the agglutination, and here you will see the agglutination in first case. Next you will see that here is the RBCs, and in that situation you will see what type of antigen present in this case? H, okay, this is good. And you also see the B antigen, also good, okay. And you also see the A antigen. Now B antigen is opposite to the B antibodies. So in that case you will also see the agglutination in that case. So this is the case. Now, last case in which you will see that what type of, here is the A antigen, here is the B antigen, and last is the H antigen. So in that situation, you will see never see the any agglutination. So you will see the agglutination in first and second. So I declare it. Here is the blood group, and blood group is the AB, and you will never see the agglutination in the last case. So I declare it negative. If I move forward, then you will see this is the red blood cell. This is the RH antigen. Okay. Now you see the H antigen. Okay, and you see the A antigen. So this is the final case. So here is the B antigen. So now you will see this antigen is opposite to the A antibody. A antibodies. So same case, you will see the agglutination in that case. So I give it a star. And next, if I move forward, then you will see this is the RBCs, and in that situation, what type of antigen? B antigen, and here is the A antigen, and here is the RH antigen, and you see the H antigen. So in that situation, B antigen is opposite to the B antibodies, then you will see the agglutination in that case also. So next, last is the R. So in that case, you will see the RH antigen, and you see what type of A antigen and H antigen, and last is the, here is the B antigen. So now the main focus is on the, if RH antigen is opposite to the RH antibody, then you will see the agglutination in this case. So if there is agglutination in first, I declare it is A. B also form the agglutination AB. So if there is third agglutination, then I declare it, here is the case, I declare it AB on the basis of first two. If there is agglutination in third case, then I declare it AB positive. So here is the case, AB positive and AB negative. Now move forward, then you will see the fourth case. This is the first case, and this is the second person, first person and second person. So in that case, you will see only the H antigen. In first person, you will see the H antigen. In the second, you will also see the H antigen along with the RH antigen. Then, now there is no antigen present in both case, then antibodies can present in that case. So in that case, you will see here is the antibodies, and that antibody is actually the B antibodies, and you will see here is the A antibodies. So you see the two types of antibodies present, both A and B antibodies present in this case, and this is actually the this is the case. Now move when we add the blood in these antibodies A, B, D, or you can say RH, then what will happen? So here is the red blood cell, and this red blood cell has only H antigen. What type of antigen? H antigen. Then you will see the any agglutination? Not at all. Why? Because there is no A and there is no B. So in that situation, A antibodies cannot do anything. A antibody cannot do anything in that case. Move forward. This is the RBCs, and in that situation you will see only the H antigen. Now there is no A and B antigen opposite to the B antibody. So in that situation you will never see the any agglutination. Move forward. Here is the RBCs, and in that situation you will see only the H antigen. So here is the case. Now there is no RH antigen against to the RH antibodies. So you never see the agglutination in that case, and you will see there is no agglutination in the 3 case. Now this blood group is actually the O on the basis of the absence of the agglutination in A antibodies and B antibodies, I declare it O. And if there is no agglutination in the third case, Rh antibodies, then I declare it negative. Send. Now move forward. So here is the case. Now this is the RBCs, and in that here is the Rh antigen and here is the H antigen. So here is the case, no A and B antigen against to the A antibodies. So here is the case, you will never see the agglutination in this case. Move forward. Then here is the RBCs, and this RBCs has Rh antigen, and you also see the what type of H antigen. So here is the case, no B antigen present against to the B antibodies, you never see the agglutination. And last case, here is the RBCs and here is the Rh antigen and another antigen which is the H antigen. So in that case, you will see that H antigen is present. Again, corresponding to the here is the Rh antigen is present corresponding to the Rh antibody. So in that case, you will see the agglutination. So first and second case, you will never see the agglutination. I declare it O. And in the last case, you will see the agglutination. You will see the agglutination and I declare it positive. So this is the case. Now move forward. There is a special case. There is a special case. Here is the person 1. Here is the person 2. In that situation, you will never see the any H antigen. You will never see the H antigen. Now person 1 has no antigen. Never HAB RH. There is no antigen present on the RBCs. This is the case 1. And in that situation, you will see the only RH antigen. Then what antibody is present in opposite to that? So as we discussed that, you see here RH, if there is no RH antigen, then opposite to the RH antibody is present. But now this person will not produce the RH antibodies because this person, Rh negative person, will only produce the Rh antibodies when he exposes the blood having Rh antigen. So now this person will not produce the Rh antibodies. So this is the case. Now we discuss the when there is no H antigen, then if there is no H antigen, then opposite will be the H antibodies present. So here you see the H antibody. There is no H antigen, you will see the H antibodies, and in that case you will never see the exposure of the blood having H antigen. They produce opposite to that. Here is the same case, H antibody in the both case because there is no antigen. The H antigen, opposite you will see the H antibodies. So this is also the opposite case. Next, if you see that this is the RBCs, there is no A antigen, opposite to the A antibodies, you will never see the agglutination. This is actually the Bombay phenotype. In Bombay phenotype, you will never see the H antigen. Next, this is the RBCs, there is no B antigen, opposite to the B antibody, never see the agglutination. Here is the RBCs. In that situation, you will never see the Rh antigen. Opposite to the Rh antibody, you will never see the agglutination. And I declare this person has blood group O negative. So this is the case. Last is the Rh. If you see that here is the blood and this blood having Rh antigen. So in that case, there is no A antigen, opposite to the A antibodies, you never see the agglutination. So move forward, then this is the RBCs having Rh antigen. In that case, you will see there is no B antigen, opposite to the B antibodies, then you will never see the agglutination in this case. Now this is the case when you will see the Rh antigen. Rh antigen present corresponding to the Rh antibodies, then you will see the agglutination. In that case, you will also see the blood group in this case will be O positive. So now, do you notice that these condition O negative, O positive, O negative and O positive are basically similar. Then what are the difference between these two groups of the person? You see that in this group, you will see the H antigen. But now, in this group, you will never see the H antigen and H antigen. So, this is actually the normal O group. and this is actually the Bombay group. So, or you can say Bombay phenotype, in which you will see there is no H antigen, but it will look like O. So this is the case. Bombay phenotype has no H antigen and they actually look like the O blood group. So this is the case, and in the forward grouping we cannot distinguish between the O blood group and the Bombay blood group. This is actually the case. In this case you will see the result will be the same. So I cannot distinguish between the O blood group and the Bombay blood group. So this is actually the deep concept of the forward grouping. In that case, you will see the A negative, A positive, B negative, B positive, and AB negative, AB positive, O negative, O positive, O negative, O positive. So these are basically the forward grouping. So this is all about the forward grouping. If you have any question, then you may ask in the comment section. Thank you.